So my name is Annette Bauer. I'm assistant professor at the Care Policy and Evaluation Center at LSE, and I'm an economist by background, and I'm doing mixed method evaluations in mental health and social care in the UK and globally. I'm particularly interested in understanding methods that allow us to work with stakeholders. So they're called participatory economic evaluations, or at least that's how I decided to call them. But basically, there's a challenge of economic evaluation findings not being used in practice. So findings from economic evaluations are findings that help us to understand the cost of an intervention or a program or a policy, as well as the outcomes, and compare those. The issue is that often those findings are produced in a research-led environment and they're not being taken up in actual practice. And that's for various reasons. Like, one of the issues is that whilst they're helping us to understand in theory how something works and how much it costs, they often are not shedding light on some of the costs of implementation, which can be quite substantial. So therefore, there are many reasons why economic evaluation findings don't get accepted in practice or don't get implemented in practice. And we can use participatory approaches in economic evaluation to address those issues. So there are currently no standard methods for doing participatory research in economic evaluation. We can learn from other fields, but it basically means that you're working collaboratively with stakeholders, which are the people who are interested in the economic evaluation or affected by the findings from the economic evaluation. And you're trying to really work on a situation together. But it can mean different things in different situations, and it depends on the types of research as well and the types of economic evaluation. So, for example, we have for a long period of time doing research with stakeholders on developing research on the cost of perinatal mental health problems, which is informed by research evidence, but there are also many kind of like evidence gaps, especially as we are looking into a kind of like lifetime perspective of cost of perinatal mental health problems and the impacts on mothers and children. There are many kind of like data that are very kind of like context specific. And so what we are doing is we are developing methodology that allows stakeholders in those countries, which includes practitioners, people with lived experience, to come in and really help us thinking about which findings from the research are more relevant than others. And together we are developing a process of coming together to findings about good estimates for the studies and finding the cost of perinatal mental health problems, for example, but also return investment. The great thing about that approach is that you're not only kind of engaging people in the process and getting better data and making the research more relevant, but you're also creating some capacities for future research and for more kind of like transformative changes. So another example I can provide is from the study we did called the Value and Care Guidance Study, was looking at the implementation of guidance in social care. So in England and Wales, guidance is produced nationally by the National Institute for Health and Care Excellence. And a lot of resources go into developing those guidance, but we don't know much about how it's being implemented. So we worked closely with local authority sites, but also a range of partners, service user and care representatives, to really look at how guidance is implemented currently and understand the processes as well as the cost of doing it and some of the potential values. The advantages are that it increases the relevance of the findings to the real world, basically, and it allows us to understand the problems more from the perspective of those who actually are experiencing the issues. And that includes practitioners, but also people with lived experience, policymakers. And in itself, it's a process that can lead to more kind of like capacities for transformational changes. Or I'm particularly interested in hearing from people who want to learn more about how to involve stakeholders in economic evaluation and in research more generally, and really learn about the best methods of doing so. And also interested really to hear from, obviously, not just researchers, but also practitioners, people with lived experience, who think there's real value in kind of getting involved in economic evaluations. Because a lot of the time there is this kind of perception that maybe economic evaluation is very technical, and the benefit of being participating in economic evaluation is not that great. And so that's what we're trying to challenge. So anyone who thinks that that might be something interesting for them to look at, really keen to kind of get in touch.